A new study shows a shocking rise in deaths among young and middle-aged adults in the U.S. over the last decade, which is driving down overall life expectancy. That's not what we're used to hearing. I'm joined tonight by Dr. Stephen Wolf, a professor from VCU and the lead author of the report, which was published in the Journal of the American Medical Association. Dr. Wolf, welcome. Thanks for coming in.
Pleasure being here.
So tell us, we're so used to knowing that the U.S. spends more on healthcare per capita than any other country in the world, and yet this statistic, increasing mortality and falling life expectancy for people 25 to 64, these are the young and the middle-aged, presumably in the prime of their lives. What is happening here? This
is the working age population of the country, and we're seeing this very disturbing increase in death rates that's really been going on for decades. Now we're starting to see U.S. life expectancy decrease because of this trend.
And what are the causes? I mean, I know there just must be legions of people trying to figure out all these causes. We've heard of, the opioid epidemic, the explosion in the last couple of decades with that. What are these underlying causes?
Well, the opioid epidemic is a big factor. Drug overdoses are probably the leading reason for this increase, but hardly the only one. There's also been an increase in deaths from alcoholism and suicides, which led some researchers to call these deaths of despair. But our study showed that we've had increases in 35 causes of death in this age group. And some of the largest increases are in young adults, 25 to 34.
Somebody at home watching might be saying, hey, I've got a child in that demographic, or I myself am in that demographic. What do we need to do to change that? What are the steps? I mean, you've identified the patterns that are out there, and you know what's happening. Are solutions something that are just too hard to come by?
Well, as a physician, the health advice about healthy lifestyle, not smoking, losing weight, and so forth are obviously something I would recommend. But our research tried to understand the root causes of this. We looked at the data for all 50 states, and that helped us locate which parts of the country are most deeply impacted by this. And frankly, our national trend is being driven by a handful of states.
And what are those states? I mean, is it states that, was it a surprise, or the interior of the country, the coasts? Where are the impacts being felt?
Historically, the Deep South has always had higher mortality rates and worse health outcomes than other parts of the country. We were expecting to see the increase to be greatest there, but it actually turned out to be the Rust Belt, the industrial Midwest and Central Appalachia that had the largest increase.
So that's Ohio, Pennsylvania, Kentucky, and Indiana?
Exactly. The Ohio Valley, 4 Ohio Valley states accounted for 1/3 of the excess deaths that have occurred in the country because of this trend.
So excess deaths, that phrase is a chilling one to me, because basically if you have a death rate and over a period of time the death rate increases, you can figure out, knowing what the population is, how many more people died. 33,000 excess deaths. That's enough to fill a stadium.
It's the equivalent of 2 737s crashing twice a month for 8 years. This is an alarming trend, and it's worsening. So it's very important for the public and for policymakers to focus attention on addressing the root causes.
And so we mentioned earlier that we've fallen behind our European counterparts or other industrialized nations for more than 20 years now. What are they doing that we're not doing?
Well, a number of steps that they've taken over the years to try to provide support systems for people who fall on hard times or having problems with jobs, employment, income, young families, parental leave, a variety of programs that they've invested in to try to help their population get through these health threats.
Well, I regret to say we are out of time. Dr. Stephen Wolf, professor at VCU. Actually, you're the director emeritus of the Center for Society and Health at VCU.
The Center on Society and Health.
You wear many hats.
Yes.
Thank you, sir, for coming in. Appreciate it.
Thank you.
Let's send it over to Francis.
Well, we're looking at mostly cloudy skies. We do have a high pressure system that's going to start to build over the course of the next couple of days, and looking at the possibility of seeing a winter system. I'll have all those details coming up.
Doppler Max 6 is sponsored